joining us now live in studio, we have Dr. Erica. Thank you so much for coming in.
Of course.
And she's talking this morning about Men's Health Week. So tell us about some of the biggest health issues specifically for men.
Right. So, last year, I think during this week, we talked about how men don't go to the doctor or seek care as much as women do. And that's still an underlying theme that I think we need to remember. But, the number one most common cause of death in men is going to be cardiovascular disease, same as in women, but still 1 in 4 men will die of cardiovascular disease. And 1 in 15 over the age of, I think 45, they said, have significant cardiovascular disease or notable cardiovascular disease. The only way you're going to know this is if you go to the doctor and get checked. And the best way to prevent significant cardiovascular disease is obviously not smoking, controlling your weight, eating a healthy diet. And every time I say healthy diet today, you can translate that to Mediterranean diet. If that makes it easy, that continues to be the, in studies, maybe the best balanced diet for people to avoid things like cardiovascular disease, keep your blood pressure under control, keep your weight under control. Yeah.
Okay.
Then I think the next one we have on is the cancer, second leading cause of death in men. And, colorectal cancer, it's important to mention again that they decrease the screening age for colonoscopies to 45 years old from 50 years old for those at normal risk. So it's important to get in and get referred for that. Also lung cancer, especially in people who've been smokers, skin cancer with all of our sun exposure, seeing the dermatologist or your doctor regularly, and then prostate cancer, and I'd add in there testicular cancer for the younger men, men-specific cancers. Important to know the signs and symptoms, and prevention and early detection is key on that. Diabetes is more common in men, type 2 diabetes especially. Again, it's on the rise, and again, a Mediterranean diet, controlling your weight, making sure you have good exercise, healthy diet. And then to kind of finish us off here, we have the osteoarthritis. 1 in 5 men have osteoarthritis. I'd say maybe as you get older, almost everybody does. Age, poor movement, obesity, again, keeping your body as healthy as possible so you put less wear and tear on those joints while also staying active. And then mental health, we always have to mention mental health. And again, in men, also because they're less likely to seek care if they're having depression or anxiety, and they're also more successful and higher rate of death from suicide. So if you're concerned about yourself or someone else, dial our crisis line, suicide line 988. But make sure you get in and address mental health early and soon with all of these factors to keep, if you are a man or the men in your life, healthy.
So first step would be to schedule a routine checkup. Just for anybody who might need to rip off the Band-Aid, this sounds like something scary. What happens at a routine checkup, and how easy is it to schedule?
You can call our hospital line, as well as in other regions where you are, if it's closer to be primary care there, but get the next appointment with any of the providers that are accepting new patients. And then it's just important for your doctor to know what your risk factors are, look at your family history, which falls into a lot of these as well. It's not as scary as it may seem. A lot of the exams people don't look forward to, especially as men, are not needed as much as they used to be, and we can look at tests and symptoms a little bit more like blood tests. So it's important to get in there. If putting your head in the sand is not going to prevent any of these things from occurring. So take a proactive approach to stay healthy.
Okay, so if you've been feeling anything at all, you've been wondering if you should go in, here's your sign. Thank you so much, Dr. Yearly.
Yeah.
Thank you so much.
You're
Great information.
welcome.
We'll be back right after this.